You always do this to me. You always mention some side issue that warrants its own video. And one of the symptoms of steroid addiction you just mentioned was hair loss. Can you expand on that a little bit?
Okay. About 90 to 93-4% of the addicted people, the red skin syndrome people, are atopics, are eczema people. The other 7 to 10% have other diagnoses. We've talked about that repeatedly. That's why it's not bad eczema only. Atopics, eczema people, have a tendency to lose hair. They have a very specific aside while they're in the throes of growing up, usually, child, can happen in adults also, where they lose hair in areas, and it's called alopecia areata. Little circles of baldness occur, 1 to 10. The rare person, luckily, can lose all the hair on their body. Alopecia universalis. The results of regrowth are, I don't have numbers. Most of the little guys regrow the little circular spots. There's a in general, you can be very reassuring. They usually do it once and that's it. Those who keep doing this periodically, a few years later and a few years later, the outcome is not as sanguine. But still, it's a rare occurrence. So there is a hair problem. In the RSS addicted people, as I mentioned before, women lose hair in general. Not a lot, but enough that it shakes the heck out of them. They get frontal loss, like male pattern baldness, and it's not that it's coming out in droves, but enough to scare them very much. And it's at the beginning or early on in RSS. I always thought the mechanism was steroids are related chemically to progesterone. Progesterone causes hair loss. Estrogen makes hair grow. That maybe indeed there's the answer, and was always only in women. Men didn't lose hair. Even those who had the tendency, who had the genetic code for frontal loss at age 20, they already were losing and peaking. Only the women. Now there was a recent article that you had sent me that impugned the use or implied that the use of birth control pill with higher levels of progesterone might be a factor in hair loss in eczema people. So not only are they losing it because of the addiction, they're also losing it because of an exogenous hormone called birth control pill, which contains a higher amount of progesterone. Something to be looked into, but this paper you sent me from one of the throwaway journals, a lay journal, was from a good source, a good study, and seemed to be a very well done paper and a very well done research. Most of those addicted people and RSS people, maybe all of them, as best I can tell you, regrew their hair, despite maybe still being on the birth control pill. And I had never really inquired about, I always inquired about, are you on any other medications when I first started seeing people, and I disregarded if they were on the birth control pill, that it was not a problem.
Well, and I guess my concern is, well, let me ask you this question. Can a person become steroid addicted through the use of steroid inhalers for the treatment of asthma? Can they develop red skin syndrome?
No, you must be topical. You must start with topical. You must get addicted through the skin. It affects the blood vessels. The addiction is constriction of the vessels with resultant dilatation. Constriction of the blood vessels with dilatation. And then the vessels say, I'm not constricting anymore. I'm staying dilated and red.
But that can only be achieved through the use of topical steroids. External.
And then if you give internal eye drops, asthma puffers, IM steroids intramuscular, prednisone orally, it worsens the process and spreads it all over. My suspicion, strong suspicion, is the asthma people go through the same thing. Their lungs are addicted. The vessels in the lungs get addicted to the steroids there also. I'm uncertain as to the numbers of teenagers and adults who are still having asthma, because I'm always in my teaching, my information is that asthma burns out in the vast majority. So they don't have difficulties later on. I know you're reading my computer. I know you were hiding in the corner of this room because I was on the phone this morning with a patient from Toronto who had been on board last year with red skin, who was very afraid that his inhaler that has steroids, because he's having difficulty breathing, is prolonging the process. So he refound me, and I said, we have to talk about this on the telephone. I know you were listening to that conversation. Interesting, that coincidence. I mean, these things are very commonplace.
Are respiratory physicians open to the discussion of the patient approaching them and saying, I'd like to get off, is there a non-steroidal solution to my situation? Is that a conversation that can happen?
I'm sensing that doctors across the board are pulling back with less steroid usage. There's enough. Either we have done a lot of damage, or others have come on board, or the drug companies pushing non-steroidal things, impugning the severity of the usage of steroids, and it's reaching a head where I'm sensing they're using less and less. They might not know why they're doing it, but they're doing it. But if you use the word addiction, that means verboten, nothing. You're addicted to the opioid. You cannot take a little opium. You're addicted to methamphetamine. You cannot take a little steroid. You're addicted. If you only imply that it's a problem and you need to pull back, you stop short of pulling all the way back. So that's the message we're trying to get across. You're addicted, you're addicted. You're never going to get better.
Until you stop.
Until you stop.
So just going off the rails a little bit, Rogaine, have your thoughts on that, its involvement with topical steroid addiction to prevent additional hair loss?
I happen to have been involved with the drug study for Merck on Propecia for male pattern baldness 20 years ago. I was one of the investigators. It grew hair. Not luxuriously, but it did a good job, and minimal, if any, side effects. It was rivaling Rogaine, which had been out for several years. It was a blood pressure medicine that coincidentally was found to grow hair on the face. And some smart person at the drug company said, let's use it for baldness. Aha, nirvana. What's the...
Eureka.
It never was that good. But because people were desperate, men and women, Rogaine rose again from the abyss, came on the market again. It depends who buys the company out, and they start advertising. Propecia was given to women. Results are hard to come by because it's so subjective.
And those are non-steroidal drugs.
And they're non-steroidal.
I remember Rogaine was marketed not to regrow hair necessarily, but to keep what you have from falling out. That was beautiful.
That's called a ruse.
Isn't that beautiful?
Yeah, that's called chicanery. I want you to drink water so you won't be thirsty. Oh, really?
Oh, Lord. Okay.
The advertising, we've never impugned the advertising people. They're the culprits in many of these situations.
Well, but it all goes back to the patient really taking charge of their health care and informing themselves, having agency and being their own advocates. I guess that's the simplest way to put it. We don't want to do that. We want to go see the guy in the white coat and have him give us a pill and solve the problem.
But if you get rebuffed quickly by the guy or gal in the white coat, you're hitting a brick wall and you pull your horns in. You're afraid that you won't get good care or the right drug or whatever. I better listen. I better shut my mouth. He's well trained, 12 years ahead of me. Well, he also is an arrogant son of a gun. He also doesn't know his stuff often, et cetera, et cetera, et cetera.
I have a friend that works at Passages, the recovery center up in Malibu. And she tells me that the people that are there, who are in some cases injecting drugs, heroin, all that stuff, they insist on GMO-free and organic food while they're there, and during group they'll smoke like chimneys.
I was just going to say they smoke also. Yeah.
How do you reconcile all that?
They compartmentalize perfectly for their own need and their inability to shake a bad habit.
Do we all do that? Maybe on some level, maybe not to some degree, but I mean, is that a human characteristic?
Yeah, we grab the extra candy.
Yeah,
but we make up things. I have another article for you. It was in the Atlantic 2 issues ago. A study was done. I won't go into the details because I haven't fully finished it. That said, ice cream is good for you. Diabetics benefit from eating ice cream. And it was a well-grounded study looked at by his professors. It was a med student. Were
they named Ben and Jerry?
And that it was helpful to the diabetic. It seemed to ease the ability to get into trouble heart-wise. And it's like, and then the article at the end says, all these tried and true things that we believe for hundreds of years are shown to be wrong often. I have to read in depth, but it did appear in Atlantic, and I don't trust everything in Atlantic and Harper's, but they're well thought out articles. It could well be. Just like this. 80 years of topical steroids using, what are you talking about? That they get addicted. Yes, indeed they do.
Incredible. We almost killed the egg industry during the cholesterol days. Almost killed the entire industry.
Well, I told you, and maybe I have to relay this to the public, that when we were together for several days with 2 other people, 6 people at breakfast for several days, and we were talking about health, about this, about that, and I said, I think I'm going to have to take a photograph of these 6 platters that have the remnants of eggs in them.
Right.
If this was 10 years ago, they would lock us up in prison for, they were going to die of heart disease. And arrogantly pushed by doctors. Arrogant.
I watched a cardiologist the other day who was contending that arterial plaque is reversible, and the way that you reduce it is by consumption of vitamin K1, which most naturally occurs in eggs and beef and dairy and cheese. It's like, what? I'm on a roller coaster here.
I would like to know how he gets inside those little arteries.
No, I know that, but I mean just the sentiment shift.
Yeah.
Just the sentiment shift. All right, I'm rambling. Doctor, thank you. Please like, share, and subscribe, and we'll just keep repeating and getting our message out there.